Now, that's Good Chemistry, a podcast devoted to exploring chemicals in our lives. I'm your host, Susan Savage. We are broadcasting from our studio on the campus of Indian Hill High School, located in Cincinnati, Ohio. Joining me today is the podcast editor, Tom Millard, and Dr. James Kong, a cardiologist at the Christ Hospital. Welcome, gentlemen. February is American Heart Month, a time when all people, especially women, are encouraged to focus on their cardiovascular health. Today's Now That's Good Chemistry is the second part of a special two-part episode featuring Dr. James Kong, cardiac specialist at the Christ Hospital. In our previous episode, Dr. Kong shared three main points. First, that heart disease is not inevitable. Avoiding overprocessed foods, refraining from smoking and vaping, and engaging in daily exercise, even light exercise, can reduce the risk of heart disease significantly. Second, cardiac plaque is never normal, but it is more common as people get older. And finally, maintaining low LDL cholesterol levels is the goal to maintain a healthy heart. As we pick up in our conversation with Dr. Kong, I ask him about the importance of diet in maintaining a strong heart health. As he explains, the issue of diet is not as clear-cut as we would like.
So that's a very complicated question that we don't actually know the answer to entirely. Diet is a very hard thing to study, and the sort of Western scientific paradigm of breaking a problem down to its single essence doesn't work as well applied to diet because it's so complicated. What we can say is that we can observe the kinds of diets which have multiple sorts of components to them that tend to be healthier or more favorable in terms of atherosclerosis or not. One example of that is the Mediterranean diet. And we think that one of the features of the Mediterranean diet are that it's very diverse. There are a lot of phytonutrients, so those are plant-based chemicals that are abundant in a Mediterranean diet. Saturated fats, we see an association between that and high LDL. And LDL is what we were talking about before as the sort of bad cholesterol that's lousy, you want to be low. Diets that are high in saturated fats have a higher risk for LDL, and saturated fats tend to come from animal products. So to help my patients remember, I say the more feet it has, the more saturated fat it has, and if you move toward the foods that have fewer feet or legs, you're probably better off.
Tipping point for plaque buildup, that is there a certain point past which coronary plaque simply attracts and builds more plaque, or can plaque be reduced at any point through non-physical means?
Unfortunately, none of those chemicals that I mentioned before actually cause the plaque to regress or to shrink. We don't have any way to sort of dissolve it, unfortunately, at this point. And so much of the goal of treatment is to focus on stabilization, to reduce inflammation so that the plaque is less likely to grow and then occupy space and become a blockage, and also so that it is less likely to rupture and cause heart attack. And stabilization can be achieved through the medications that we talked about, the statin medications or the HMG-CoA reductase inhibitors. Aspirin prevents the blood clots, and all of those heart-healthy lifestyles we talked about are just as important as those medications. So a person can take their aspirin and their atorvastatin, but they also should do their exercise and follow a heart-healthy diet, because that will achieve that plaque stabilization that we're looking for.
Okay, I know that you shared with me before the podcast about having a tiny diamond-dusted drill bit that you can go in and kind of flush away or pulverize some of the plaque. Can you share with us about the drill?
It is pretty cool. So one of the techniques for treating plaque when it has become a blockage is angioplasty, which is a term that refers to using balloons or other devices to modify the plaque or reduce its size to improve blood flow. There's other treatments, but this is the one that I specialize in. Many times, the plaque has a lot of calcium built up into it. And that calcium is like a rock. It's a mineral, and it accumulates in the plaque, and it's like a rock. And many of our conventional devices can't do anything against a rock. We inflate a balloon, and it cannot crack or smash the calcium. So we have to use other techniques, and probably the most effective one we have is this drill. It's called a rotoblader, or the technique is called rotational atherectomy. So the device spins. When you hear about it, it'll blow your mind, because this device, first of all, it has to be small enough to fit inside the blood vessel. So the tip or the burr, depending on which size you select, is anywhere from 1 1/4 to just over 2 millimeters in diameter. So it can fit inside the blood vessel. It has to be flexible so that it can take all the turns and bends inside the blood vessel. But then here's the cool part. So it also has to have the capability of removing the calcium. And the way that it does that is at first it's covered with microscopic bits of diamond. And it's on the front end, so as the physician advances the drill, those diamonds are pushed up against the calcium. And then it has to spin or rotate, that's why it's called rotational, usually at speeds of 180 to 200,000 RPM. And so while it's spinning, it's advanced up against the calcium, and then we take advantage of a principle called differential cutting, which allows the hard parts of the drill to remove the hard parts of the blockage, which is the calcium, but then spare the elastic parts. So the healthy tissue then doesn't get injured. So that's differential cutting, which is to sort of imagine what an example of that is like when you're shaving. Yeah, so if you're shaving your face or your skin in general, the razor will remove the hard part, which is the hair, but spare the skin, which is soft or elastic.
We hope.
We hope,
spares
usually.
The skin.
But yes, that's how it happens ideally, yes.
That is truly fascinating, and we do know, we did an episode on the gems, and diamonds are one of the hardest substances, and it's fascinating to me that we're making progress with heart treatment using something like a diamond and a drill. Before there were diamond-dusted drill bits to break up the plaque in the heart, what surgical means were used to remove the plaque? Because you've talked about the balloon kind of expanding the artery, or a stent keeping the artery expanded. Was there any other way of removing the plaque before the drill?
Well, there's a special kind of balloon that has blades on it. They're small blades, and we call them microtomes because they're very small. And so the balloon is deflated so it can be inserted into the blood vessel. And then when the balloon is inflated, the blades, which are folded inside in the folds of the balloon, then are sort of unfurled. And I think this is sort of a physics principle where the radial pressure that's exerted by inflating the balloon is then concentrated in the narrow surface of the blade. And so that allows the balloon to then concentrate its force onto the calcium. And in that way, hopefully crack the calcium without doing what a standard balloon might do, which is to tear the artery in the soft part. So if you inflate a standard balloon, it might move preferentially toward the area of least resistance, which might be the healthy part of the tissue, and that's how an injury can occur. But this cutting balloon can be helpful to address the calcium in certain cases. There's another type of atherectomy device, which is a laser, which is similar to the drill in that it's a catheter that's flexible and has to be introduced to the blood vessel. And it introduces laser energy at the tip of the catheter in the blood vessel, and it has 3 interesting ways that it modifies or reduces the plaque. There's a photochemical effect where the chemical bonds are broken down of the substances in the plaque. There's a photothermal effect because the laser energy heats up the blood in that area, or saline. We sometimes will run saline through there as well. And then there's a photomechanical effect because the heating creates bubbles, and these bubbles expand and then collapse or cavitate, and that can also disrupt the plaque through mechanical forces. And then this is not before the rotational atherectomy, but our newest device to address calcium, and this is, you'll love this too, so this is cool also. It's called, the principle is called intravascular lithotripsy, and it was a technology that was borrowed from using high-frequency sound waves to break up calcium in other places, kidney stones, which are more than calcium, but the idea is the same. And so with this device, this balloon is inserted into the blood vessel in the plaque, and it has electrical elements inside of it that heat up and then in a pulsing manner over time, and that creates bubbles inside the balloon that expand and contract, and that generates a shock wave that can then transmit that energy out into the wall of the blood vessel and crack the calcium that way. So it's sort of like if you had a sheet of ice, in the wintertime, and you tap on it, and it cracks all over the place. These micro cracks are kind of what you see with that device.
So 2 questions. What do you fill the balloon with? You said you inflate the balloon. Mm-hmm. What are you filling it with?
It's just salt water, saline.
Okay.
So we put saline inside, and then we put a little bit of contrast material, which is the stuff that allows us to see where it is on X-ray.
Okay.
But that's all that it is.
And then when you break up the plaque, specifically the calcium, where does it go?
That's a great question, and that's when I tell patients that this is what I'm about to do, that's always the question they ask, what's going to happen? Fortunately, because of the way the device works, if we're talking about the rotational atherectomy or the drill, the particles that are created are very small, less than 10 microns usually. And as a point of reference, a red blood cell is 7 microns on average. So these particles are very small, and they can just float off downstream through the microscopic vessels, and then the body just clears them.
Truly, truly fascinating. So once a patient undergoes surgery, I presume they are put on medication to prevent further plaque buildup. What chemicals are central to these medications, and how do they prevent the plaque buildup?
So 2 of the chemicals we mentioned, which you would take even before an intervention. So that's the aspirin or acetylsalicylic acid, and then the statins, the HMG-CoA reductase inhibitors. After an intervention, though, there's another class of medications, blood thinners, if you will, that work against platelets, and they're called thienopyridines or P2Y12 inhibitors. P2Y12 refers to the cell receptor on the platelet. Remember, platelets make blood clots, and we want to prevent that. So these medications block adenosine diphosphate, which is a chemical that's all over our body, but is released when the body's trying to make a blood clot because it activates platelets by binding to the P2Y12 receptor. And these medications, which are in pill form, clopidogrel is an example of that, ticagrelor and prasugrel are names of the 3 that are in use today, block that receptor. And they're used in conjunction with aspirin so that you have 2 blood thinners to prevent a blood clot from forming inside a stent, for example, which is part of the angioplasty.
So you have the medications, and the question I would ask after a patient has gone through the procedure and you've gotten rid of some of the plaque and pulverized it, can they return to normal activity? Do you encourage them to begin exercising and eating better? What are the other steps besides the procedure and then the medication?
That's a great question, and because I think that question is often, I think, the one that's missed, because I got excited talking about the drill, and there's a sort of summit of attention and anticipation about doing something, which is an intervention or an angioplasty. But when you ask about what you can do about atherosclerosis or heart disease, everything that happens after the angioplasty or the drill is as important or more important than that intervention. And those are the things that in recovery, which is generally pretty quick because the procedure is minimally invasive, people are back to normal activities within just a couple of days. We might recommend a program of cardiac rehab to kickstart exercise. And we want people to exercise, even if it's just a little bit, but to do something every day. To follow that heart-healthy diet, the plant-based diet that we mentioned before, and also to sort of take stock and look at what constitutes a healthy lifestyle in general. So that might include stress management or stress reduction, and addressing sleep disorders, mood or anxiety disorders. All of these things may have some impact on either the progression or the slowing down of atherosclerosis. So all of those things are part of the recovery. Ideally, once a patient has control of their atherosclerosis with these medications and these lifestyle changes and their intervention, they just go back to a normal, productive lifestyle and doing whatever they want.
To recap, the nature of diet is complicated. However, diets that have certain characteristics have been shown to promote heart health. One's diet should be diverse and include many plant-based foods. Diet should be low in saturated fats. One easy way to keep saturated fat intake low is to think that the more feet a food source has, the more saturated fat it has. Once plaque has developed, it is there. However, its growth can be prevented through exercise, good diet, and pharmacological interventions. Exercise and diet are just as important as heart drugs in maintaining low plaque levels. Many exciting and truly incredible surgical interventions exist. Along with pharmaceutical tools, heart patients have more resources than ever before, but the most important intervention is the easiest and most basic one: maintaining a healthy lifestyle through regular exercise, a good diet rich in plant-based food, and stress management. Thank you, Dr. Kong, for providing us with just some life-changing information. I would say life-saving information. Now, That's Good Chemistry is a collaboration between the students and faculty at Indian Hill High School in partnership with TARA, Toxicology Excellence for Risk Assessment. Our technical supervisor is Indian Hill and Television Network executive producer and technology teacher Denny Dubs. Our script supervisor and editor is English teacher Tom Millard. Our graphic designers are students Liz George and Ryan Kennebeck. Our theme music was composed by former student Preston Marks. Thanks to the faculty, staff, and administration at Indian Hill for their behind-the-scenes efforts and support. Until next time, I'm your host, Susan Savage.